This is the physical examination test that I had to perform at school. This exam consisted of a head-to-toe assessment, and we only had 30 minutes to perform the entire exam.
30 minutes for this exam. Enter the room when you are ready.
Come in.
Hi,
Hi.
my name is Patti. I'm one of the nursing students for the Nurse Practitioner Program.
Hi.
If you're okay, I'm going to go ahead and start the exam.
Absolutely.
All right, so head is midline and erect. Eyebrows, eyelids, nasolabial folds, and mouth are symmetrical. I'm going to go ahead and, let me see, pretend I cleaned my hands here, and I'm going to touch your head. I'm just going to feel. Okay, so hair is smooth and the color is silver. There is no lesions, no lumps. Hair is evenly distributed. Let's see here. Skull is normal cephalic and scalp is intact. I apologize, my hands are cold.
Okay.
I'm going to feel for your temporal arteries here. Okay, any pain or tenderness?
No.
All right, I'm going to listen for breweries on both sides. I do not hear any breweries. I am going to have you take your glasses off. Are you okay with that?
I am.
All right, I'll put that right over here. Okay, then from there I'm going to have you open your mouth for me. Go ahead and close. Any pain or tenderness?
No.
No pain or tenderness noted. No crepitus, no popping. Again, go ahead and tightly close your, all right, perfect. Trigeminal nerve intact, and that's the motor part of the trigeminal nerve. I'm going to feel for your sinuses here. Any pain or tenderness?
No.
Okay, no pain or tenderness noted at the frontal and maxillary sinuses. I'm going to have you do a series of facial expressions.
Okay.
If you raise your eyebrows, wrinkle your forehead, smile for me. Okay, and smile without showing your teeth. Okay, and then if you poof out your cheeks, all right, and then purse your lips and blow. All right, and then tightly close your eyes. All right, facial nerve grossly intact. Her facial expression is pleasant. I am going to also put something soft on your face, something hard.
Okay.
And for the sake of time, I will do just one side, but it will be bilaterally.
Okay.
Go ahead and close your eyes. Tell me what you feel.
Hard,
Okay.
soft,
Okay.
hard, soft, soft, hard.
Okay. Trigeminal nerve and sensory function intact bilaterally. All right, I'll put these down here. All right, then I'm going to have you bring your arms straight out, and then you're going to be touching your nose but closing your eyes.
Oh,
All right,
okay.
go ahead. Okay, no ataxia. You can go ahead and stop. Coordinated movements, smooth coordinated movements. I am now going to go towards your neck here, and visual inspection of the neck is symmetrical. Trachea is midline. I'm going to feel for your carotids here. I'm sorry, my hands are cold. Any tenderness?
No.
Okay. No tenderness at the carotid arteries. I'm going to listen again. And no breweries noted. All right. I'm going to feel for your lymph nodes. So I'm starting at the occipital, the postauricular, preauricular, retropharyngeal, the submandibular, submental, supraclavicular, anterior cervical chain, posterior cervical chain. Okay, so, and any tenderness there?
No.
Okay, so no tenderness, and these lymph nodes were non-palpable. I'm going to do a little bit of range of motion, so I'm going to
Okay.
have you look up towards the ceiling, so that's flexion, no, that's hyperextension, and bring your head down for forward flexion. I'll have you look to the right and to the left, so just rotation. Bring your ear to your, and to the other side, and lateral bending. So this same motion, I'm going to have you push against my hand,
Okay.
both sides. Go ahead and push, and this side. Then shrug your shoulders for me. Okay, full resistance to opposition, spinal accessory nerve intact. From there, I'm going to feel for your thyroid. Okay, go ahead and swallow for me. Okay. Thyroid is pliable, soft, no nodules, no lumps, masses, and it moves during swallowing. All right, so now I'm going to go toward test your eyes here. So I'm going to just hold on to your chin. If you, for the sake of time, we're going to do one side and consider this
Okay.
bilaterally. If you watch my finger. Okay. So extraocular eye movements are intact in all 6 cardinal fields of vision, smooth coordinated movements. Okay, so my next thing is going to be confrontation test. So what I'm going to do is have you look at my ear. When you see my fingers come into your peripheral vision, let me know. Okay.
No.
Okay, that's about 90 degrees.
No.
Okay, 90 degrees. So confrontation, intact, visual fields full by confrontation. The next thing is accommodation. So I'm going to have you follow my finger. Perfect, and look behind me. All right, so pupillary accommodation intact, constriction and the eyes constrict and converge when looking at a close object and dilates when looking at a far object. Okay, so the light here. Let me see. Okay. I am just going to have you look at my ear again. I just
Okay.
want to look at your pupils. Well, hold on, let me do it this way first. Okay, so light shines in both eyes symmetrically and bilaterally. All right, so for the sake of time, I'm going to pretend I turn the lights off just to
Okay.
do these 2 tests. I'm going to look at my ear again. I'm just going to shine this in your eye. Okay, so pupils are equal, round, reactive to light and accommodation, direct and consensual. So I'm going to look in your eye and we're going to consider this bilaterally. So, apologize, I don't want to be right. Okay, so I see red reflection. I see blood vessels in the back, so arteriovenous ratio of 3 to 5. There's macula that's yellow, and I see a cream-colored disc. No exudate on the eye. Okay, put that back up. Okay, so from the eyes, I'm going to go to the nose. A visual inspection of the nose is smooth. The nares are equally positioned. I'm going to feel your nose here. There's a nice stable structure to the nose. It's the same color as the facial skin, which is a light pink to peach. Let's see here. All right, so I'm going to look in your nose, and this will be bilaterally. Okay, so I do see turbinates, middle and inferior turbinates, where you're glistening pink and moist. The septum is straight, fairly straight and midline. Okay. Now I'm going to look at your ears. So I'm going to pull your hair back. There you go. Visual inspection of the ears are symmetrical. The top of the auricle is horizontal with the inner canthus of the eye, and the lateral position is less than 10, equal or less than 10 degrees. I'm going to look in your ears. I do not see any drainage. There's no odor. I'm going to feel your ears here. There is a firm, stable structure with the cartilage. It recoils from folded position, and the color is the same as the rest of the facial skin, which is light pink to peach. I'm going to look in your ears. And this will be considered bilaterally. I'm going to pull up and back. Okay, it's a pink canal. And Any tenderness with the canal there when I pull on your ear? Okay, no tenderness. Your ear looks really good. I see the tympanic membrane, which is pearly gray and translucent. I do see a bony structure and the light reflected. A little bit of cerumen, varying shades of yellow, but not bad. Okay, and that was bilaterally. If you were a child, then I would assess if the child could have an ear exam now or at the end based on if it'd be traumatic. And so when I do perform the ear exam, I'm going to pull down and back to visualize the tympanic membrane. If the child is crying, then I would recognize that the tympanic membrane is going to have a reddish color. Okay, so the mouth.
I have a pretty good gag reflex.
Okay.
Just to warn you.
Okay, thank you. So the mouth, visual inspection of the mouth is symmetrical both vertically and horizontally, with movement and without movement. The lips are well defined from the rest of the facial skin. The lips are pink, light to dark pink in color. Okay, so I will have you open your mouth for me. The buccal mucosa is pink and glistening. The gingiva is light pink, firm and moist. I'm going to have you just show me your teeth. I'm going to just push on your teeth. Teeth are firmly anchored. The color is a pearly white with some yellow stains, which is very normal. I've got 32 teeth that I can see there. And then just bite down. The top teeth fit nicely onto the grooves of the bottom teeth. All right, I'm going to look at the top of your mouth. So the hard palate is dome-shaped, and the protuberance of the hard palate is midline. It's continuous with the soft palate. Soft palate is a nice pink color, and same with the hard palate. The uvula is midline. If you'd say ah for me. Oh, perfect. So the soft palate rises when saying ah, and uvula stays midline. I'll have you stick your tongue out for me. Tongue is pinkish in color. Anterior surface is smooth yet roughened. Posterior surface is smooth yet slightly raised. I'll lift your tongue straight up. There's blood vessels on both sides of the frenulum. I don't see any leukoplasia, lesions, masses, that type. So while we're working with the tongue, I'll just have you bring your tongue towards your nose, towards your chin, side to side. Hypoglossal nerve intact. Okay, so I want to peek at your tonsils. Say ah again. Okay, perfect. So tonsils are symmetrical. They're pinkish in color. There's no exudate, and the size is a +1. The back of the throat, I did see some blood vessels back there. It's moist, glistening patches of lymphatic tissue, which is normal. Okay, so that is the mouth. Now, I am going to have you pull down your gown just so I can see your chest there. I can help you.
Got it.
Perfect. The lights, by the way, I put them back on after the eye exam.
Okay.
Okay, so on visual examination of the chest, the AP diameter to the transverse diameter is a 2-to-1 ratio. Front of the chest is symmetrical, and chest expansion is even with breathing. Okay, so respirations are between 12 and 20 breaths per minute. There's no labored breathing and no use of accessory muscles, and it's a regular rhythm. I'm going to just listen here. And I'll just do one side, but it will be considered bilaterally. Deep breath for me. Okay. Deep breath for me. Perfect. Deep breath. Perfect. And one more. Okay, so I have clear breath sounds, no adventitious breath sounds. I want to check your kidneys, so what I'm going to do, and that's bilaterally, I'm going to let me know if there's any tenderness here. Any tenderness?
No.
Tenderness?
No.
Okay, so no costovertebral tenderness. Now going towards the heart here. I'm going to first listen with the diaphragm. All right, so on the right side, 2 intercostal spaces down for the aortic valve, pulmonic, herbs, press a little bit hard here, tricuspid, and let me get under here for mitral. Now with the bell, same thing, aortic, pulmonic, herbs point, I've got tricuspid and mitral. No murmurs, a regular rhythm, and that would be between 60 and 90 beats per minute. If I was listening to the S1, it'd be the apex of the heart, and S2 would be at the base of the heart. Now I'm going to feel for your pulses, and this will be bilaterally, but for sake of time, we'll do one side. So the radial pulse, brachial pulse. I'm just going to feel right in here. This is the femoral, okay. The popliteal, the posterior tibius, the dorsalis pedis, and it was good pulses on all of that bilaterally. Okay, so I'm going to inspect the arms and the legs. Visual inspection, there's even distribution of hair on both the arms and the legs. You are warm, cool to warm to touch. I do not see any edema, no deformities, no masses, no lesions. I'm going to just check your capillary refill. And capillary refill on your fingers. And that's less than 2 seconds on all 4 fingers and toe, or on both hands and feet. And I'll look at your nail. Excuse me. Look at your nails while I have you here. Nails have variations of pink and opacity. The ends of the nails are smooth. The shape is convex, and there's longitudinal beading and ridging. That looks good. Okay, so from here, if you could lay back for me, I'm just going to look at your abdomen. I'll bring this out a little so your feet don't hang. I'll look at your abdomen. Perfect. Okay, and I'm going to go on your right side since, okay, so visual inspection of the abdomen. There's no scars, no striations. I'm just going to bring this down a little bit so I can see your belly button. Okay, and then it rises with breathing, evenly with breathing. Okay, and the shape of the abdomen is slightly rounded, and the maximum point of convexity is at the umbilicus. The color is the same as the rest of the skin. Okay, I'm going to listen to your stomach here in all 4 quadrants. Okay, I do hear clicks and gurgles, 5 to 35, which is normal. While I have you here, I'll listen to the aorta and the renal arteries, the iliac arteries. No bruits, no friction rubs, no venous hums. Now I'm going to just percuss on your... So I hear tympany in areas and dullness over the organs. I'm going to go ahead and palpate. Let me know if you have any pain or tenderness. And this is just lightly to begin with. Now I'm going to go a little bit deeper. Any pain or tenderness?
No pain.
Okay. So a little bit deeper here. Stomach remains, or abdomen remains soft, no tenderness, no masses. Now I'm going to palpate for the liver, which I would go under the ribs like this. And for the kidney, like this. For the spleen and the aorta. Okay, perfect. So you can put your gown back on if you'd like,
Okay.
but go ahead and stay laying down.
Okay.
So I want to just assess your hip movement. So I'm
Okay.
going to bring your leg out this way. So this is abducting the hip and adducting. Now I'm going to bring your knee in. This is external rotation, internal rotation, and all those movements are good. Now I'm going to bring this in and have you sit back up like you were when I walked in. Okay. Perfect. Okay, so I want to just look at your knees here. I'm going to have you bring your knee out for hyperextension and back down for flexion. We're going to do those same movements, but you're going to push against my hand. If you push up, perfect, and push down. So full resistance with opposition using the quadriceps and the hamstrings. Then what I want you to do is bring your foot down for plantar flexion and bring them up for dorsiflexion, but again with resistance. So bring your foot down, okay, and bring it up. And that full resistance with opposition. You bring your feet kind of in like this. Perfect for inversion and then out for eversion. Okay, so I am going to peek at your hands. I can tie that real quick for you. So if you bend right at the wrist for me, perfect. That's a flexion of the wrist and bring it up, hyperextension of the wrist. Now if you just bring the fingers down, or just like that, yep. Help you out here. So this metacarpal flexion and metacarpal hyperextension or extension. Now I'm going to have you do this, perfect, and this. Okay, so no limitations to the thumb opposition. If you bring your fingers out for abduction and adduction, and bring your wrists in for inversion of the radial and eversion of the ulnar. You grip my fingers here, a firm sustained grip, and then if you place your hands on here and just rapidly, okay, perfect. So no limitations to rapidly alternating movements. Let me check your reflexes here. Okay, I'm going to just have you stay as loose as you can there. Okay, I've got bicep reflex present. I'm going to bring you back like so. Tricep reflex present.
Ooh,
Oh, sorry.
you got that one? I have really good reflexes.
Patella reflex present.
That's the real thing. I really do that.
Okay, so Achilles reflex present, and then I'm going to, there we go, plantar flexion present. Let's see here. Now what I'm going to have you do is bring your arms in like so. So flexion, extension of the elbows, and now with some resistance, so push up, push down. Okay, full resistance to opposition using tricep, bicep. And then now I'm going to have you go like this for pronation and supination. So in, out, so eversion, or inversion, eversion. All right, and then I'm going to have you stand up. All right, if you just follow my movements.
Okay.
So we're going to go for flexion and hyperextension. Then if you do external rotation, internal rotation, we're going to do abduction and adduction. Okay. And while I have you standing, since I couldn't feel your hips, I'm going to just feel okay, anterior, posterior, iliac crest, and greater trochlear is symmetrical. So I'm going to look at your spine while I have you standing. Any pain or tenderness?
No.
Okay, no pain or tenderness. Spine is erect. Spine is straight when erect. So I'm going to have you follow my movements as well with this. All right, we're going to touch our toes. Reflection. Oh, you got good. Wow. All right.
Yoga.
Yeah. And hyperextension. We'll do some lateral bending and rotation. Okay, perfect. Then from here, I am going to have you just walk a little and then come back. So gait is steady, even strides and rhythmic motion. And then I'm going to have you put your feet together. I'm going to be right beside you, so don't fall. If you close your eyes just for just a little bit, go ahead and open it. And slight swaying, no risk of falling, and the Romberg test is negative. I feel like flew through this, so.
You did.
All right, you can sit back
Okay.
down. Very
All
nice
right.
to meet you. Was it
Very nice to
pleasant?
meet you. It was pleasant. Your hands weren't that cold.
Oh, good, that's good.
Bye-bye.
Bye.